do a very brief introduction, which might be a little longer, but I'm Catherine Bradshaw. I'm the Senior Associate Dean here in the School of Education, and I'm a faculty member affiliated with Youth-Nex, and I am thrilled to be able to introduce our invited speaker here today, Dan Flannery. He and I have known each other for a number of years through a National Academies panel that we were on. But before I get into his introduction, I wanted to do a few remarks about our land acknowledgements for those of us who are here in person in Charlottesville, as well as those of you who are online, the people of all lands that each of us are on today. We do this in reaffirmation of our commitment and our responsibility in improving the relationships between nations and to improving our understanding of local Indigenous people and their cultures. From coast to coast, we acknowledge the ancestral and unprecedented and unceded territory that the people of all First Nations, that they call this land their home. In addition, the Youth-Nex is housed within the University of Virginia, an institution built and supported by enslaved people. We recognize that enslaved men, women, and children and their ancestors and their commitment to working for the readiness and redressing inequalities and white supremacy that have resulted from the histories of our institution. So with those acknowledgements, I want to also acknowledge that today's session is co-sponsored by the Youth-Nex Center and the University of Virginia's Gun Solutions Project. I am thrilled that the director of the UVA Gun Solutions Project is here today, Bobby Doyle, so I've invited him to stand up and make a few remarks about that project.
Thanks, Catherine. Lots of remarks. I'm emphasis on a few. My name is Bobby Doyle. I have UVA's Gun Violence Solutions Project, which is focusing on actionable solutions to addressing the scourge of gun violence. Really, when Catherine and her team approached me to say that they were bringing in Daniel, I was really incredibly excited by the opportunity to co-sponsor. People who, there's not many people who've worked over decades to focus on violence and the ways that development and youth are affected by the violent behavior in the communities, and then perpetuate our subjects of that as they grow older. And as a project that's starting up and interested in how people can do great long-term interdisciplinary deep research on these really tough topics, I think the speaker today really is an example of the wonderful things you can do by looking into this in a serious long-term way. So I hope everyone gets a lot out of this, and I'm really excited to hear his remarks.
Great, thank you. And if you are interested in learning more about that initiative, feel free to reach out to Bobby.
Yes, please do.
Great. And now for those of you to learn a little bit more about Youth-Nex. Youth-Nex was founded in 2009 to expand and apply the science of positive youth development and to address fundamental challenges facing the societies around the world. Through science and community partnership, Youth-Nex enhances the strengths of youth and adolescents and prevents the developmental risk. Our vision is that the nation's youth and rich and untapped resource may flourish. The current director is Nancy Deutsch. She is unable to be here today because she's off in Minnesota for SRCD, but I'm sure she would love to hear from you if you are interested. We have many other Youth-Nex faculty and affiliates that are here. So with that, I would like to introduce our speaker today, Dr. Dan Flannery. Is a distinguished university professor and the Simi J. and Ruth Begun, is that how it is? Begun professor and director of the Begun Center for Youth Violence Prevention. I guess it's just violence prevention, not necessarily youth violence, although I think of you as a youth violence person. But that does research and education in the Joseph and Morton Mendel School of Applied Social Sciences at Case Western Reserve University. He received his PhD in clinical and school psychology from the Ohio State University, and he has published over 130 papers and book chapters. He is a licensed clinical and school psychologist and a professor of psychiatry and pediatrics at Case Western University Hospital Cleveland Medical Center. His primary areas of research are in youth violence prevention, the link between violence and mental health, and community-based program evaluation. He also just recently was inducted into the American Academy of Social Work and Social Welfare, so which is kudos to him. Today, he'll be sharing his research and a title entitled Challenges to Positive Youth Development, Violence and Mental Health in Everyday Life. So with that, I will pass it over to you. Thank you so much for being here.
Thank you, Dr. Bradshaw. Thank you. It's a lot of words to fit into a 35-year plus career, but I say that somebody recently said, not bad being inducted into the Academy of Social Work as a child psychologist. So I guess there's that. So I'm done now. There's nothing else to do. I'm going to talk a little bit about a long history of work in the area of violence and mental health, with some of our earlier work leading up into our most recent work. And I'm going to touch briefly on a number of different initiatives, many of them longitudinal projects. So we continue to collect data and work with various populations at risk. But I want to start with a brief overview of the center to give you some context of how and why we are able to do this work. So the Begun Center for Violence Prevention is community-based research and evaluation. It's we have very few individuals who are sort of sitting around at the computer all day just working on secondary data analysis. We have many teams that are actually embedded with our partners in the community, whether that's a community-based agency, the court system, or a local or federal law enforcement departments. So that's a little different than the sort of traditional academic model, because we're also very multidisciplinary, multi-systemic, and multi-level. So while we're a center on violence prevention broadly defined, many things impact violence, including mental health and substance use, folks that are involved in the criminal justice system, obviously education and school, law enforcement, community-based. We actually have a couple of large training and technical assistance centers that are part of the Begun Center. So this is a very simplistic overview of the Begun Center. So we inherited the Begun Center name when we moved back to the Case Western Reserve in 2011. Prior to that, I was director of the Institute for the Study and Prevention of Violence at Kent State University in Ohio, which was established around that university's history with May 4, 1970 and the shootings there. So what's unusual is that we have 6 different centers that are part of the Begun Center. So trying to describe anything going on at the Begun Center that's also part of this long-named school of applied social sciences gets to be a little bit tricky. But we have 2 major centers of excellence in child, youth, and families that do training and technical assistance and evidence-based practices for interventions for youth, like multi-systemic therapy, functional family therapy, and the like. And we have 2 centers of excellence that deal with adults in evidence-based practices. The most recent, the Substance Use Disorder Center of Excellence, that was funded by the State Department of Mental Health with HHS ARPA funds, which were terminated without warning March 24th. So the remaining 6 months of that 3-year center grant was $2.7 million to our center, affecting 25 or so different people, full and part-time. So we're still dealing with that and working with our governor's office to see how we address that moving forward. This Child and Adolescent Behavioral Health Center of Excellence is a $4 to $5 million a year center that's part of the state's trying to address the child serving system across the state, particularly for kids who are multi-system involved. So we have both training and technical assistance of providers in those evidence-based systems, but we're also collecting pre-post treatment outcome data for any child that gets intervention services, collecting that data longitudinally, and then working with our Medicaid office at the state level, who wants us to do fidelity assessments, making sure the treatment teams are implementing those interventions with fidelity in order for them to get paid. So it's a nice combination of training and technical assistance with the research and also making sure that things are being implemented in the right way. This is a recent example of the structure of the center. I don't have space to put all of the degrees on here, but I could tell you that we have anthropologists, sociologists, social workers, psychologists, educators, lawyers. We have a physician. We have a couple people that are former federal military intelligence, DEA, ATF people. So it's not just all academics. And to me, this is a very intentional structure of multiple perspectives and disciplines addressing what's a fairly complicated behavior. So that's kind of where we start the conversation of the relationship between violence and mental health, right? So I'm going to talk a little bit briefly about some of our historical work in that space, which has led up to more recent efforts. One's the Department of Justice Defending Childhood Initiative, a longstanding collaborative with the juvenile courts across the state, where we divert kids from the juvenile justice system into community-based treatment and assess their impacts and outcomes. We also do a number of things in youth development, which I'll touch on, and lastly, some work more recently on gun violence. With the caveat, of course, for all of us in this room and online, I don't know what the next 3 to 6 months will look like, let alone the next 3 to 5 years in these spaces. This is a slide that I'd like to show just because sometimes I get asked, well, you're a center on violence prevention, but why are you doing all this other stuff? Well, because they all matter in terms of making an impact here in this space. It's not just the individual child or adult. It's not just a mental health issue, and it's the rhetoric around it's not the gun that kills people, it's the person, and it's all mental health in schools. It's the resolution that would help, but it's not going to solve the problem overall. So you can't do these things in a vacuum and just look at one piece of the puzzle if you want to affect long-term systemic change. And yes, sometimes it gets messy and political, which is why I think we've been busy for 3 decades, is because a lot of our academic colleagues don't want to do this kind of stuff because it doesn't all get published. I like showing this because I'll just bring it to your attention the year. It's 1997 when I made this up, and it still holds true today. What does this really mean? Well, to me, there's a multitude of factors, and I could put more things on here with more intersecting arrows, which begin prenatally, right? Genetically, prenatally, depends on the family you're born into, the environment, context, etc. There are so many things that interact to end up contributing to whether or not a young person ends up having difficulty in early, middle, late adolescence. That if we don't start early in identifying these factors and do something about it, that window of opportunity to affect change gets smaller and smaller and smaller as our youth get older and older. And the effort it takes to affect the change because of all of these intersecting factors becomes much more difficult and much more expensive. Stepper Prothero-Smith, one of our longtime colleagues, has said before, eventually our youth will get our time, our attention, our money, and our resources. And it's up to us to decide when that will be, sooner or later. So this also reflects other lives that I've had in low birth weight outcome studies and other kinds of things. I've never been in a psychology department, by the way, so I'm going to reveal to you that I've been in family studies in the College of Agriculture, the School of Medicine, the psychiatry department, criminal justice, then public health, and now social work. So I'm unemployable as a psychologist in a psychology department, but it's partly a reflection of the path that I've taken in a very multidisciplinary way. So this is, again, the early version of what we now, the Bronfenbrennian multi-layer context approach, that you can't just deal with the individual youth who's in a family, who's in a neighborhood, attends a school. And many of the kids that we're talking about today are multi-system involved. They've had contact with juvenile justice, with education, child and family services, etc. And oftentimes now at younger and younger ages, law enforcement in the juvenile justice system. Again, to oversimplify a complicated process, this is the basic model that drives a lot of our work. right? It's the relationship between violence, exposure, and violent behavior mediated by mental health, trauma symptoms. But what's been different a little bit in the work that we've done in this space is that not only have we looked at victimization versus witnessing recently in Lifetime, but we've paid a lot of attention in focusing on context, homeschool and neighborhood, because we've seen very specific differences depending on a youth's exposure as witness or victimization in those contexts on the one hand. And on the other hand, you're getting into poly-victimization, which we've assessed in a slightly different way than Finkelhor and others to show that exposures around victimizations as witness or direct victim matter not only in the near term, but over time. So we'll come back to this briefly later. But one of the studies that we did a few years ago that started all of this was a combination of school-based surveys with kids in Arizona elementary schools. This is 3rd to 5th graders, elementary and middle schools in Ohio, and high schools in Ohio and Denver, Colorado. And so this is a data set that's about 11 or 12,000 all told, depending on what you're looking at. And it had a significant number of Native American youth in the Tucson, Arizona area, and Hispanic youth as well. So I want to talk briefly about this first set of studies. We asked about witnessing violence. This is just an example of the kids in grades 2 through 8 across urban, essentially urban, suburban, and rural communities. And the percentages of kids who self-reported witnessing violence in the past year. So I just want to say that the percentages of kids, for example, that witness someone being threatened at school, these are in the 70s, 80 percentile in the central city and suburban communities. Somebody being slapped, hit, or punched at home. Somebody being slapped, hit, or punched at school. So having a real gun pointed at you, the numbers in the central city are quite high, and they're even higher now. So this data is a few years old. But even the numbers of individual kids reporting that they've witnessed someone being sexually abused, 35% of males and females in the central city. And these are kids in school. These are not kids in juvenile justice or child welfare that are being surveyed. Percentages of kids that report being victimized by violence. They've been a victim of violence. And one of the things that we've done a lot in is the whole area of threats, right? So we had this data available to us when Columbine first occurred. And we had just collected this data. And we asked this question, threaten somebody, have you ever threatened to hurt someone else? I'm gonna talk about that in a second. Because the original rhetoric, Dewey can tell you more about this than I can, was that kids make threats all the time, it doesn't really mean much. They're joking, it's not serious, etc. And as professionals, we've had a long history of being, having a duty to warn, right? If someone makes a threat to hurt themselves, that sets off bells and whistles. There's a protocol to assess that risk, the seriousness of their plan, have they tried something before, etc. There was nothing in place for kids who make threats to hurt other people. So we had this data that said, look, kids self-report hurting other kids, threatening to hurt other kids. Let's look at them and where they're at with respect to their mental health and their behavior. So this data allowed us to do some of that. So this is the self-reported violent behavior across those 3 cohorts, boys versus girls. This is their reports of beating someone else up. 50% of boys in the elementary school hit someone before they hit you. So that's sort of peremptory violence, right? This isn't after. We asked both those questions. Nearly 50% in elementary school, nearly 60% of boys in high school have hit someone before they were hit. These percentages were higher than we thought. And again, we didn't ask to shot at someone of the little kids. We asked for the adolescents. Nearly 20% of boys in high school said that they've shot at someone with a real gun within the past year. So one of our first early studies on this was predicting self-reported violent behavior in grades 3 through 8. Enter all the demographics, enter parental monitoring, it's significant, 5%. Watching violence on TV, because this is always a big question, does media matter? right? So it adds something to the variance, but very little. Recent violence exposure, which was our measure about witnessing and victimization, home, school, and neighborhood. It adds 25% to the variance of predicting whether or not a child is then acting out aggressively. Lifetime violence exposure added almost nothing to the model after that. So does media matter? A little bit. It's recent violence exposure as witness or victim that carries the weight in terms of whether or not a young person in as early as elementary grades is acting out in an aggressive or violent way. You look at trauma symptoms, right? So this is the trauma symptom checklist. And look at the percentage of kids who are in the clinical range of their self-reported trauma symptoms. So kids that are low in self-reported violence exposure versus high. So we took the top and bottom quartiles and looked at the percentage of those youth who were then clinically reporting symptoms. Look at the grades 9 to 12 anger for boys. You have a third of all young boys reporting clinical levels of anger when they're in a high violence exposure group. This is consistent with Jim Garbarino's story about angry young boys having an issue with violence perpetration in our communities. And that hasn't receded. What has changed is the number of girls who are also now reporting significantly clinical levels of anger and depression related to their aggressive, violent behavior. So we looked at this. So risk for self-reported violent behaviors in kids who say that they threaten to hurt other kids versus kids who say that they don't. And here are the 5 main violent behavior questions that we looked at. So this is the risk of acting out in this behavior, whether you're an infrequent threatener, which is the blue bar, or a self-reported frequent threatener to hurt other kids. So you can see that kids that admit to frequently threatening other kids are 15 to 20 times more likely to engage in these behaviors, hitting someone before, beating out someone else up, attacking them with a knife, or shooting at someone with a real gun. That to me shows the importance of paying attention to when kids make threats to hurt other kids. We even asked teachers about their reports of who makes threats to hurt other kids. So if you just do a simple 2x2, teacher says yes, kid says yes, teacher says no, kid says no, etc. So the highest group in that 2x2 was teachers say the kid doesn't make threats to hurt others, and the kid self-report says no, I don't make threats to hurt others. What was the next highest group? Teacher said no, kid said yes. So the teacher says, no, this kid isn't a problem. The kid self-reports says, yeah, I threaten to hurt other kids all the time. So we often look to our teachers to tell us who the problem children might be, and I pay a lot of attention to teachers with a lot of experience in first, second, and third grade saying this child stands out for these reasons. But even when you ask teachers, they don't know everything that's going on, right? The kids are much more willing to self-report things than we think. And then we see, well, these again are kids coming from school surveys, but we have kids reporting fairly high levels of aggressive and violent behavior. So we looked at again, the highest levels of violent behavior, stabbing someone with a knife or shooting at someone with a gun, and then matching them by 4 or 5 different demographic characteristics: age, gender, ethnicity, forget there was one other one, and matching them as a control. It was a case control study, right, of the dangerously violent kids versus matched controls. And you see it was more predominantly male than female, but we still had females in that group. And this is what they look like demographically. Males, dangerously violent males reported much more often using a gun. Girls reported much more often using a knife to hurt someone. Boys ran on using both a gun and a knife in terms of their aggressive, violent behavior. But here's the trauma symptom role here. When you look at trauma symptoms and you look at who is more likely to report anxiety, depression, etc., it's girls, right? And then we figured out that our dangerously violent females were nearly 20 times more likely to report an attempted suicide compared to everybody else, right? So while males get a lot of attention, even the dangerously violent males came out lower than the controlled females in terms of risk for suicide around their mental health issues. It's not often you have males in the lowest group of anything in this space. So where did this lead us to sort of in the end of this round of work? So, well, if you have these kids that are in schools and they're reporting all these high levels of exposures to violence and engaging in aggressive violent behaviors, well, what do you do? What do you do to cope with things when you're stressed out? And so the top two things are what everybody says they do, adolescents: listen to music and talk to a friend. The next group is the thing that distinguishes significantly the most violent by self-report males and females relative to everybody else. Getting angry and yelling at people, saying something mean, using alcohol or drugs is 2 to 1 as a coping mechanism, talking to a family member, etc. Be with a boyfriend or girlfriend. Most violent kids say that's a coping mechanism for them. The next thing is what nobody does. It's one of the lowest endorsed coping mechanisms. Talk to a teacher, minister, or counselor. So when you're stressed out and trying to deal with things, that's not what our kids are doing. And then the bottom ones don't differentiate between the groups much at all. So the general story here, of course, is that maladaptive coping strategies tend to favor our most violent, aggressive youth. No surprise there. But the lack of the supportive coping strategies is also a big deal. So this gets us towards the end of the spectrum where you're like, okay, we can't just focus on reducing aggressive violent behaviors in this space. We have to focus on improving positive things and social emotional competencies, etc., resiliency, which is what the center here does. So let's talk a little bit about one effort in this space that's more recent. We had a Defending Childhood Initiative grant, which is the Department of Justice under Eric Holder, looking at violence and mental health. And in our community, the decision was made to do 3 things. The decision was made to develop brief screeners for youth and child welfare and juvenile justice around violence and trauma, because none existed in our public systems. The second was to then offer a fuller assessment of youth that needed it based on that screening. And then the third leg of that stool was to provide trauma-informed treatment to those who required intervention. So we spent a lot of time looking at the screener data, and then more recently looking at the fuller intake data. So I'm going to briefly show you, these are both publicly available, free of charge screeners that have been published. I think this one, the little kids, is in violence and victims. And the adolescent version is in child abuse and neglect. So this is done at intake for little kids, almost all in child welfare by caregiver report, right? 1-year-olds aren't self-reporting their trauma symptoms. But this was, the screening items were developed from 7 items from the National Survey of Children's Exposure to Violence, and 8 items from the Trauma Symptom Checklist for Young Children. Again, we arranged it a bit in the location of violence and demographic items. We also had some critical items that if you self-reported injury, imminent harm, suicide, etc., you were immediately referred for additional assessment. But also, this is one of the vagaries of community-based work. Intake workers were given the opportunity to override whatever the assessment was, because we had cost scores and things, and we had a lot of intake workers who just referred whoever they screened. Like they need additional assessment, sort of a cover your butt strategy. So I'm gonna refer somebody for more assessment, whether they really need it or not. So we're looking right now at the link between the screener data and the fuller assessment data, and did it generalize well. So average age is just under 5 years for the younger kids, and these are predominantly minority children. But keep in mind, these are children and their caregivers referred to child and family welfare for potential abuse and neglect. And this is caregiver report on these issues when you know who the caregiver is. So when they say that 1 out of 5 children have been exposed to violence, at least one kind of violence, you perk up, right? This is different from an anonymous survey or a national anonymous phone survey, which is most of what Finkelhor's work is. In kids who've witnessed any type of violence, again, 1 out of 10. The trauma symptoms for a young child are a little different, right? It's irritability, trouble sleeping, eating patterns, etc. It's different from the older kids. So this was just over 6,000 kids in the young screener when we eliminated all the 8-year-olds that got the birth to 7 screener. On the adolescent screener, it's 8 and older. And so this is by youth self-report on this screener. The difference here was that we had all of our own data, which I just showed you, with over 10,000 kids reporting on violence exposure and trauma symptoms. So we were able to use that data as our pilot data to select the items for the screener that loaded the best in each of those symptoms. Like, what's the best loading item on anxiety on the trauma symptom checklist, the best loading item on anger, etc. So that's, we were able to collect those items to create the initial version of the screener. Did pilot work with 500 or 600 youth, pared it down by a few more items that people weren't really endorsing or didn't seem to tell us much. So violence exposure, violent behavior, and trauma symptoms. This screener takes about 6 minutes to do. So this has gotten a lot of play in pediatricians' offices, or at least in audiences of pediatricians who want something quick to do. We did submit this data to the JAMA Network Open, and our friend Fred Robbins is the outgoing editor. He didn't accept it because it's county data and not national data, but I have to say it was one of the nicest rejection letters I've ever gotten from the journal, which was, oh, this is very great and interesting. We're just not publishing anything that's not, nationally representative sample data. So I thought that was, my team was like, oh my gosh, I'm like, look, this is the nicest letter you'll ever get from rejecting a paper from a journal. So cherish it that way. Over 20,000 kids, we have clean screener data. So we do have a number of 7-year-olds and 19-year-olds that we eliminated from the sample for this particular study, spanning early to late high school. And again, predominantly minority. The average age is about 13 for this group. 3 out of 4 kids self-reported at least one type of violence exposure, with pretty equal distributions among males and females. So we don't have the community-based differences between boys and girls. And this is, again, way more kids in the juvenile justice system in the adolescent sample, not just the child welfare system. Whereas the young kids are almost all child welfare. Over half reported at least perpetrating one aggressive or violent behavior. And again, other than the slap, hit, or punch, we don't see much difference between the boys and the girls. Nearly 70% reported at least one trauma symptoms. So again, these are self-reported kids in a public system that you know who they are. This is not anonymous reporting. So our experience has been when we look at our juvenile justice samples, our child welfare samples, we get lower rates of reports of these things than in the community sample. We think that's one reason why, is that kids in school-based surveys are reporting anonymously as well. Kids in the public serving systems are not anonymous. These are 3 critical items on the adolescent screener: you being touched in a private place, females far, outpaced males, think about hurting yourself, and think about killing yourself. So these are the items that if any one of these 3 were endorsed as yes, they were immediately referred for additional assessment. So we have been looking at the full assessment data, and when you clean it all and go from paper to digital and COVID, where everything shut down for a while. We're actually in the process of trying to recover more of the intake data from the agency that did it. The clean data is just over 500 full assessments when I know we've had over 2,000 conducted. But this is a first look at the intake, the full intake data. So this is the fuller juvenile victimization questionnaire, the full violence exposure measure, the full trauma symptom checklist. We're back to that simplistic model: exposure to violence, the violent behavior mediated by trauma symptoms. So we want to look at this in the full data. So this was done recently by a group of postdocs at the center. And then they tried to explain it to me. And I said, what? So I have a whole couple pages of notes from my postdocs trying to explain to me what this model says. Because they say, what they're telling me is, this is a partially mediated model, right? That you have a significant relationship between violence exposure and violent behavior. 34% of the variance is accounted for. And then when you enter trauma symptoms, internalizing, externalizing sexual concerns into the model, the relationship between violence exposure and violent behavior reduces significantly, but it's still significant. And they say now, compared to the old Barrett and Kenny mediated moderator, if it's a true mediation model, that relationship goes to 0. Now they're telling me there are folks that are saying you can have a partially mediated model and that's still okay. And the way, what they've also said to me is this, in this particular model, if the pathway to the internalizing symptoms is significant, it actually is related, if you can see, to lowering the risk for violent behavior. So if you're an anxious, depressed kid, you're less likely to act out aggressively or violently. But if you're an externalizing kid, which is really anger on the trauma symptom checklist, by the way, and I changed the previous version of this to anger from externalizing because it's really just anger, that increases. The other thing is that this is the relationship between exposure to violence and violent behavior holds strongest for the older kids in this model. Younger kids goes away. So there's a partially mediated model moderated by age going on. So that's the best I can do in explaining what to me is way more complicated than. So here it is, the moderated mediation model, age and gender. So there's a gender thing in here too. But age did not moderate the externalizing symptom pathway. Gender showed a significant suppression effect for females, but not males. If you're an internalizer, sort of makes sense, right? Those are the acting out angry ones. The difference was not statistically significant, though, on the externalizing side. So this gets into what are we doing with violence exposure? So here's a giveaway. When I was being trained as a clinician back in the day, we were doing trauma-informed therapy. We just didn't know what to call it. Like if you weren't dealing someone's anxiety or depression and safety, and doing anything cognitive behavioral or whatever, it wasn't going to work. So we were sort of doing it in practice. We just weren't doing it with a label because there weren't any evidence-based treatment protocols that we were being trained in. We were eclectic, as they say. If you weren't psychodynamic or cognitive behavioral, you were eclectic. And I did a lot with, adolescent acting out conduct disordered males. And so I was doing whatever seemed to work at the time. Much of it didn't work well at all with that group. So we were eclectic. So now we have evidence-based practical protocols for everybody. Shifting gears slightly. So we, for the last 15 years plus, have been collecting data across various juvenile courts in the state of Ohio. Collecting data on kids that have been referred to the criminal justice system, that if they met a set of criteria without being the most violent, then they would be eligible to be diverted into community-based treatment programs, and that we would track and follow them through that treatment. And this is referred to as the Behavioral Health Juvenile Justice Initiative. This now has general fund dollars from the state that go into it year to year. So it's not dependent on grant funding from the federal government, one of the few things, right? So just as an example, as a snapshot, Since 2006, we've had over 5,000 kids enrolled in this program, 15 years old. Most of them have, many of them have both a mental health and a substance use diagnosis. We get caregiver data. 20% of youth reported someone close to them was murdered in the last year. So high levels of violence exposure and victimization in this juvenile justice population. As you can imagine, a lot of kids are diagnosed with either oppositional defiant disorder or conduct disorder. And many of them have had at least one felony charge in the last 12 months. So when we started this initiative, there were over 3,400 youth institutionalized in their state prisons in Ohio. Today, there's just over 500. So part of this has been this sort of systemic attempt to divert kids into community-based treatment, keep them in their home catchment areas for that treatment, as opposed to quote unquote shipped off to other residential prisons or out of state. Many of them multi-system involved, like that contextual figure I showed you. In the BHCJ program, this is sort of, you can get diverted to treatment. If you don't complete treatment, you're at risk of getting in prison, basically. So you have a high rate of youth completing treatment in the community. Then we've been tracking substance use and trauma symptoms, etc. But we've also been tracking expulsions and suspensions at school and the reincarceration rates, right? So the recidivism rates are pretty high. If you're a 12, 13, 15-year-old with felony convictions already, your chances of recidivating are pretty high in the juvenile. And then we actually did one study of following these kids in the adult correctional system in Dayton, Ohio, that we published recently. But look at that bottom line too. You're doing cost benefit analyses as well. It costs about $5,200 now today to have somebody enrolled in the BHCJ program. It costs nearly $200,000 a year to incarcerate a youth in the state prisons in Ohio. So there's a thing about that. The average number of charges is pretty significant across the board prior to BHCJ involvement, and the red bars are subsequent to BHCJ for those who successfully completed treatment. So we do have some significant effects in terms of recidivism, as well as we believe it's less than 3% of youth in the program have been committed to the youth correctional system once they've been involved in this program, as opposed to 70 to 80% of youth who do not. The kids who don't successfully complete are much higher rates, about double the rates of subsequent charges on a variety of misdemeanor and felony charges if they drop out of the program. So we have that kind of data. But all is not just about kids in juvenile justice and child welfare and at risk, high violence exposure, etc. Our center has been working with our county Family and Children First Council, which handles youth development and family support programs, 6 to 10 of them at any given time. And we've been the evaluator of those programs. So here's the brief list of most of them. Out of school time, youth employment. Many of you may have read about Lynn McDonald's Family and Schools Together program, which is great. We've got data that shows those kids do well. Teen pregnancy prevention, youth voice, so youth advocacy and leadership. Program called Closing the Achievement Gap, which is the 9th grade cliff in our public school system, where 9th graders are 60% more likely to drop out sometime in the 9th grade and not continue on. And service coordination teams. This is like the high fidelity wraparound model in the county across systems and services for these multi-system involved youth. We've been collecting data on every one of these programs for 15 years. That's the good news. Here's the bad news. We've been using the developmental asset profile, the county's choice to collect this data. I don't know if anybody uses the DAP, came out of Minnesota 30 years ago. It measures a whole bunch of things, but mostly measures them as you go from like bad to better, or a little worse to less worse. It's really hard to get good pre-post sort of quantitative data using this measure because it's not set up that way. It's also a very long measure. So now you're working with community-based organizations who are like, look, dude, we'll do this once, we're not doing it twice, like at the beginning of the summer and at the end of the summer. This isn't gonna show a great deal of change in 8 weeks or 10 weeks. So you've got a lot of these programs that are time limited in their support and duration, and they're using a measure that wasn't really set up to do pre-post impact outcome related work, in my opinion. So when I ask my team to tell me, what do these things look like, they give me stuff like this. We have data, we have pre-post data on 33 kids. So you serve like 10,000 kids that are supposed to be collecting this measure, and the agency like, we just don't have the data. They just don't do it. So when you clean it, you get all of what's complete, you end up with an N of 33. So there's some pre-post differences for the kids that completed out of school time programming, which is typically at a library, tutoring, that kind of thing. Sometimes gets into employment. We are collecting a lot of descriptive data. We can get that. We can get the, is this the first time you've been in a program, or if you had multiple years? We have some kids that have been like in Boys and Girls Clubs for 3-4 years. We know who they are. So there's a lot of degree of satisfaction with the programs. Over 90% say that they like this, it's helpful, and they would do it again. So that's good. Families and Schools Together has some of the best data. We've collected data on 1,600 families across 35 schools and showed improvements from pre to post in these percentages, support from parents, etc. So we've actually got data that says if you have a FAST program relative to a non-FAST school in the same neighborhood, those kids in the FAST program have done better. So we've had some ability to control for neighborhood variation. We've got SAMHSA projects that probably aren't going to continue. Systems of care work and collecting NOMS and GIPRA data on these programs. So I'm not going to go through this in a lot of detail, but we do try to collect evidence of both positive as well as risk kinds of behaviors, attending school regularly, attachment to school, etc. The kids that were attending school regularly at baseline is positive. So this is a downside, right? 63%, this is towards the bottom, but only 45% at post-test, quote unquote. So a 30% decline in kids who said they're actually attending school regularly. So the older kids get, the less likely they are to attend school. Since 2007 until the third year of COVID, we were the formal evaluators of the out of school time, my commitment, my community youth development initiative. So in our community, we have an Invest in Children initiative, which is birth to 6, and my mom was supposed to be 6 to 18. Turned into out of school time quickly because the school system, we had our own issues with the school shooting, and they wanted to do their own thing and didn't want. This was funded by the Cleveland Foundation, which is a large local foundation. So we were collecting all of this data on, again, using the DAC, which was the county's decision, doing interviews and everything else. So we have been involved in youth development programs. Several years into COVID, I went to the foundation. I said, look, we're not doing anything. Kids aren't in school. The programs aren't happening. So stop giving us money that then I have to figure out how to tell you we did nothing with your money, but spent it anywhere. So that's essentially what happened in terms of our formal involvement in MyCom is we backed up because there wasn't anything to evaluate several years into COVID. But we just still do a lot with the out of school time summer employment. And there is evidence that youth who stay involved improve in their internal assets and feelings of empowerment and support from their family get better. So there is evidence that if there's a systematic approach to youth and families from an early enough age, that kids do well. It's not just about trying to get them to do less bad things. It's about helping them get better and have the supports that they need. More recently, we've done some work in school shootings and written about violence and trauma and risk of school shootings. And this gets us into sort of the need for threat assessments, and Dewey can tell you way more about it than I can. But We did get this question in the bullying study panel as well about the role of bullying in school shootings. And I think our answer at the time is still true today, which is bullying is a thing, but it's not the thing that drives kids to perpetrate that kind of act in school in most cases. You know, there are differences with elementary and high school incidents versus college campus incidents. There's issues with who the perpetrator is it an adult or a student? All of those things are emerging as things to pay attention to as unfortunately these incidents continue. But this is an Ed Mulvey sort of comment. Ed's also on the advisory of our group of our center and was a co-author on a recent paper with me on this. Said this is a circular thing, right? Why did this young man do this terrible thing? Because he's mentally ill. How do you know he's mentally ill? Because he did this horrible act. Like, why would somebody do something like this and not be mentally ill? So it's sort of this is how mental health and shootings and the more simplistic answer of just deal with it's a mental health issue. It's not a gun issue. It's not a access to firearm issue, etc. So Ed's position, and I think very strong position when we've had long conversations about this, is sure, schools need more mental health services. It would be helpful, but it's not the singular answer to this issue. And we shouldn't think that it is. So we did this thing. Catherine, I think you were part of this group. Were you part of this group as well? We did this 8-point public health plan in response to gun violence, right? So shout out to my peeps here that were part of this, where a group of folks got together originally after Columbine was originally, and then Sandy Hook. I don't remember, there were at least 2 iterations of it, and this is the most recent iteration where we said, look, this is not complicated, right? We need to take a public health approach to this issue. And there's a way to do this without turning everything on its ear. That school climate, kids being attached to school and engaged with their education is a universal issue. And socio-emotional competencies, the problem solving, frustration tolerance. Some of these instances are related to kids that just don't know how else to respond when they're pissed off or feeling like there aren't any other options. Whatever your position on the Second Amendment is, I say when I talk about gun violence, is that the evidence is pretty clear, right? The number of guns out there matters, the easy accessibility matters, and the lethality of those weapons matter. The expanded magazines, the hollow point bullets, the switches that make them automatic, etc. So you can't just say there's nothing we can do about it because there's so many guns out there, you can't possibly get rid of them all. No, we can't. But you can't just walk into a store and buy a bazooka and a hand grenade either. There's now evidence that when the assault weapons ban was in place, multiple homicide shootings were lower than they are now. So these are, you know, you talk to some gun owners, it's like, well, we just like shooting them. It's for sport. Well, then, and we as a society have made the decision that an individual's right to purchase and have as many lethal weapons as they want supersedes anybody else's right to safety and security. It's as simple as that. So there are things that we can do at the universal level that would matter. As I briefly mentioned to folks, one of the individuals that works for me used to be the special agent in charge for the ATF in Cleveland and Detroit. And he's very clear that the tracking system for gun ownership doesn't exist, right? It's against the law to track who owns a weapon in this country beyond the time of purchase from a federally licensed gun dealer. So you've got all of the other loopholes of gun shows, private sales, etc., that we do not have the ability. If a firearm is used in a homicide, we cannot call up ATF or FBI or anybody else and say, who owns this gun? You might be able to find out where was this gun purchased. That could have been 10 years ago, right? So the chain of custody, etc., we have very little ability to actually track firearm ownership. What we're doing more now is collecting DNA evidence from weapons that are used in non-fatal and fatal gun incidents and trying to identify the user in that incident. Here's the other problem with gun violence. Any of you who work with law enforcement, they typically will list maybe the first or second charge or incident characteristic in a police report. So if there are multiple individuals and multiple weapons used, for example, in a non-fatal or fatal shooting, you may only get, the record may only reflect the first one or two. And we don't know always if it's one weapon used to shoot multiple people or multiple weapons used to shoot a few people, etc. So again, our ability to identify firearms used in violent incidents and go from non-fatal, shots to properties and stop signs, etc., up to the firearm that's used in a homicide. When it's been done in a few instances, we could trace it back to incidents that were non-fatal that eventually are fatal, and then the network of individuals connected to that firearm and those incidents. So the capability is there to a degree, but the access to that information is limited. Law enforcement doesn't want to share it, prosecutors don't want to share it, emergency departments don't want to share it. So this is a challenge for us in this space, especially given the sort of 20-year gap in federal funding, which I think will now be reinstated in terms of federal funding for gun violence research or related to it. But this is available. We've published this. There's a chapter that explains all the literature behind the public health law that was advocated, and I think it was picked up in over, 5,000, 6,000 organizations adopted this as a plan a couple of years ago. I think mostly through your website here, right? You signed on to this. So, yeah. So you played a part in this and a very significant one. So thank you.
Great.
Way to go, Leslie. I just wanted to say that, when I talk about this, I wanted to shout out this slide because this is a lot of what you do here as well. From the threat assessment to the SEL, school climate, to the PBIS. These are the things that matter. And my hope is that we will find ways to continue to push these things forward because they have an evidence base to them. And I know there's a feeling right now that science and evidence don't really matter to the folks making decisions. But my hope is that it will come back around to what does the science and evidence say when we have to make decisions, maybe at the state level with pass-through dollars as to what we support and what it means. And this is a paper we published recently in a journal about guns and school shooters and school safety. And I was telling folks earlier today, I said, one of the original recommendations I had in there was people needed to vote at the local and federal levels for their representation for people that they believed would enact policies around gun violence, gun safety that they believed in. And the editors actually made me take it out because they said, what's the empirical evidence that who people vote for actually matters in terms of changing policies around gun violence? So I said, all right, take it out of the paper, but when I talk about this, I'm going to keep talking about this. So here it is in the second bullet, beyond common sense gun laws, because there are a lot of common sense things that people will vote for. People think, over 90% of people think we have a universal background check system in place. Well, we really don't. And the things we have in place aren't effective or efficient. People think that the red flag laws that we have in place to potentially remove firearms from someone at risk for harm to self or others are actually followed up on, and they're not, right? Even when law enforcement goes into a home and says, hey, you're in a domestic violence situation, we're here to take your weapons, tell us where your weapons are. Well, here's 3 of them. Do you have any more? No. And he's got 5 out the back, shed. So they're not going in and aggressively, tearing somebody's house apart, looking for their guns. And the legal issues to get to that point, to even being able to temporarily, quote unquote, see someone's weapon is still stacked against law enforcement, even if they want to do that. So there's a lot that we could be doing, but even this, at the end here, adding an item to the YRBS, well, the YRBS has been taken down off of the websites too, right? We don't even have YRBS data to look at right now. So if you didn't download it a couple of months ago, I don't know when it's going to come back up. So I'll just say that first bullet to me still matters a lot. in our communities is to encourage and support youth voice in this space. Some of us have been working on these issues for a very long time, and it sometimes feels like we haven't made nearly as much progress on these things as we should. And we need to listen to our young people in terms of what they say they need. If we've done anything, we've gotten past the idea that singular, simplistic approaches in this space are going to address this comprehensive, complicated problem. Many of you know Bill Modzelewski, who's now retired. He used to head up the Safe and Drug-Free Schools program, a long-term friend and colleague. And he has said to me this next bullet point. He said, look, there's a lot of evidence that if you're a school building and you just make it harder for someone to get in your building, you're going to mitigate a lot of threats. So the entrances, the vestibules, the lock your doors kinds of things. And this is a person who's been all around the country and the world, talking to schools and superintendents, etc. And that's not, I don't think he's being naive. I think he's being, what are some pragmatic things we can do that are relatively simple and low cost that matter? And people don't often think about those sort of approaches to these problems. I do think we're at a place where, when the next incident occurs, and I'm sorry, I think there'll be a next incident somewhere in a school, and there's no SRO in that building because there have been cutbacks in education or law enforcement. This is when people are going to start paying attention to what's going on today, is when something happens. And not that there's evidence that SROs in a building doesn't stop the person who wants to inflict harm. There's plenty of examples where SROs have been physically present and these incidents have still occurred because you can't cover every couple of feet of a sprawling building with law enforcement. I'm a little bit, I'm still not a fan of arming teachers. There's a lot of conversations, and particularly Texas and other southern communities, and in Ohio, we have now a new law that allows teachers to be armed if they undergo a certain amount of training. My wife's just newly retired special education teacher, and she said if her school ever got to the point of allowing her colleagues to openly carry weapons, she would quit, because she said they're not responsible gun owners, carriers, whatever training you could implement. So just think about accidents and leaving your armed weapon in the restroom or locker room, or an angry kid getting a hold of a weapon, or even worse, if there's an incident, there's an adult teacher with a firearm coming out of a school building and responding law enforcement, not knowing who the perpetrator is, and someone gets accidentally shot or injured because law enforcement thinks they're a perpetrator and not a staff or teacher with a weapon. So I get it. And again, here a rural school where the closest law enforcement is 30 minutes away from the county sheriff department, and something happens and you're a school superintendent who says, my responsibility is to do everything and anything I can to make sure that doesn't happen in my school. And if arming teachers is one of them, I'm going to support it. I get it, but I don't think we know enough about it to be comfortable with that as a blanket strategy. I don't know why this is in there, but a lot. So today's talk actually comes from a book that I wrote a while ago. It was written for teachers and parents, not as an academic volume, about how we deal with violence and mental health on an everyday basis around a lot of these issues. There's a new version of the Cambridge Handbook of Violent Behavior and Aggression. I think there's a chapter in it on bullying, one of them. There's a more recent handbook version. So there's some stuff out there that covers that stuff in more detail. And then a bunch of references. So I'll just leave this as a, for anybody that's interested in any of that. So I'm gonna stop there. Questions, comments, queries, scripts, quandaries?
Questions, if folks have questions for Dr. Flannery.
Bring it on.
Ali, I say you go first.
Yeah, thank you very much. During the presentation, I noticed that there are a few elements about youth engagement with gaming and social media, because they get now exposed to violence very easily. And so how it's integrated with your findings, to what extent they're
Good question. So that's the whole bullying talk and cyberbullying and social media. That's the talk I gave at BCU a couple days ago. I would say that we have not looked specifically at gaming as the specific source of exposure, but we have, we're getting into artificial intelligence kinds of issues and cyber sexting and things, and kids that superimpose faces on bodies and put them out there, and the fact that schools don't have policies to address these things, let alone, you know, state laws. Look, there's a lot of evidence that certain kids that engage in these behaviors, if they have a lot of other, we'll call them risk factors or sensitivities to things, then I'm more concerned, right? And you know, I grew up at a time when Combat was the TV show, right? Rick Morrow. And so we all watched Combat, and we were fine. Well, this isn't that anymore, right? It's not even just violent movies and video games. It's constant, persistent, intensive exposure to violence in all of its forms, all of the time, to live streaming, to, you know, all of this on their phones, on their iPads, on their laptops. So I think all of the evidence to date shows that it's an associated risk factor, but not the driving force. Again, even my understanding of the literature on school shooters, they're not talking about listening to violent music or playing. Although there's, again, this is where the Columbine perpetrators were said to have practiced with video games and things like that. It's not the prevailing thing that comes up in the conversations with surviving perpetrators is violent video games or movies or being influenced by that. But could that change because of what they're exposed to and how intense and pervasive it is? Of course, especially for vulnerable youth. So I guess I'd say it's not no big deal, but you know, in the early days of desktop computers, what was the strategy? Put the computer in your family room or kitchen so you knew when your child was using it and you could monitor that. And then one of the well-known sayings was POS, was parent over shoulder, to say to whoever you were chatting with, you know, you're now being monitored and you got to change what you're doing. I don't know half the crap that's going on, you know, on the phone these days. And anybody that tells you they know what all the apps are, from Instagram to TikTok to all these other things, there's like 40 of them now. When something's going on with my phone, I hand it to my 23-year-old daughter and say, fix this. So I just to say to parents, put the software on your kid's phone, monitor what games they're playing or what they're doing online. That's going to play a role, but it's not that simple anymore, right? They're gaming in their room at 2 o'clock in the morning, or at school. Bigger problem, not the bigger problem. A problem is all the stuff that they're doing, and it carries into the school day. It's not necessarily happening at the school. So what's the school's role and responsibility or liability to address those things? If they're not doing those things on a school computer, what's their authority to respond? Until something happens in the school building that might have carried over from the night or the week before. So that's not a great answer. But when we talk about bullying and social media and AI, we're getting into that space of what you're worried about. Does anybody know of any causal data that says violent media is sort of causal to aggressive and violent behavior? Because most everything that I've ever read says associated, and yes, if you put them in, you know, we don't do Bobo dolls anymore. We put them in front of have them play violent video games and then see if they act out. And there's some evidence that matters.
Thank you, first of all, for your presentation. 2 questions. The first, I know you looked at 94% of males, 96% of most violent female males. listen to music as a coping strategy? What type of music?
It's not calming classical music. And when they want to be with a boyfriend or girlfriend, it's not to chat things through.
Second question, drill music is something I'm kind of getting introduced and exposed to. Are you aware of anyone who's been kind of researching drill music, and you guys understand what I mean by drill music?
So the audience, Brian.
No, you're much younger.
No. Well, there's different music that I think speaks to different themes of whether it's violence or even just kind of almost like instruction for how to act around a society that's really constraining, or kind of how to push back. Would be like my kind of broad description of it. I'm looking around like, did someone make fun of me in the background? Okay. But yeah, so yeah, is that about right, Brian?
Yeah, so it's like opposition.
Yeah, it's not, I don't know anybody that I could say are looking at this specifically. My concern about it is both the dehumanizing and desensitizing effects of like, this is just normal. And the message is one of, go back to basic crisis intervention, right? If you're in a crisis situation, whether that's a law enforcement officer or you're talking to someone who wants to jump off a bridge, one of the things you're doing first is to find out their name and tell them your name, because any kind of personal connection reduces the dehumanization of the person isn't important. So we said this, so wasn't planning to talk about this, but a year ago, my wife and I were walking across a bridge in our town that overlooks a river, and 100 feet away is a young man climbing a 15-foot fence above the concrete. And I started kind of jogging towards the guy. I'm like, hey, what are you doing? What's going on? Oh, I'm just looking at the boats down below. I'm like, come on, buddy. Like, get down. Come on down. I decided to talk him down. Yeah, it's not funny, but this bridge spans both suburbs. Right. And so I said to my wife, call 911. This guy had obviously been sort of drenched in that it rained the night before. So I got him down and I started walking with him. And so the first thing I said, hey, my name's Dan, what's your name? So we're getting talking. What are you doing? I'm looking for my friend. Start doing, if you had anything to eat, I don't know, I say, so my wife, go get a bottle of water and a bagel from the coffee shop we were walking to. And she calls 911 and officers from both communities respond. All of a sudden we have literally like 9 officers from 2 different departments and 5 police cars. And like, I'm just talking to the guy sitting on a rock, trying to de-escalate. So to me, it's the crisis. So I use the example of crisis intervention is the strategy is to get a connection to that person, to view them as a real person, not just some ambiguous other thing. So when this music portrays this stuff, hurting someone else doesn't matter. It's a mechanism to get somewhere else or to maintain your own popularity, power, etc., status in your peer network. That's the problem, right? I don't want to be confronted by a young person who has no sense of hopefulness about their future and doesn't give a doodle about who I am as an individual. That's the scary part. And when we remove their mechanism to be able to even think that way or care that way, let alone empathy or perspective taking, now we're in a whole different place with respect, in my view, to aggressive and violent behavior. And what do we do about it? So when it feeds that, whatever that is, whether that's media, music, kinds of shows we show, things without consequences, and that's what kids are exposed to over and over and over again, that matters over time. That's that big arrow at the beginning, right? You do that stuff from a very early age over time, this is what they know. We're socializing them into it. Yeah.
So great talk, great body of work. It's a testimony to all the work that you've done over these decades. Bill Modzolewski is not here, so I'll talk about him. I just want to push back a little bit on the idea that if we could make our school buildings impenetrable, that would be beneficial.
Yeah, I don't think you would say that. I think you would say there are things that schools can do that are simple and cost effective that matter. So another person in that whole space is Ken Trunk, who's from Cleveland,
No Ken West.
and he's not related to the other Trump.
Yep.
But he would say, you know, here's the bulletproof cafeteria trays. And I'm like, you can't, every school can't do that either, right? You
Oh,
can't,
he's opposed to that, and the point I really make is really not aimed at Bill. I'm just trying to be funny there, but we are spending so much money on the physical security of school buildings.
Yeah.
It is diverting funds from counselors, from teachers, from special education services, from mental health services. And there's practically a phobia of school shootings as something we think happens in a classroom or a hallway, when in fact that school building is the safest place statistically that a child can spend their time. They're far more likely to be a victim of gun violence outside of school, in a restaurant or park or parking lot. And even if you made that school building, you know, we're spending millions of dollars on doors to make the doors, you know, electronic,
right.
and so forth. 70% of fatal school shootings, 70% of fatal school shootings occur outside of the building. They didn't go into the building. And if you look at school shooting incidents in general, where just there's a gunshot or something, the vast majority of them occur in a parking lot or on the way to school. So, you know, our policy is so much focused, and our funding is so much focused on the school building's physical security. And look at the dollars spent on the security measures relative to the cut funding for mental health services.
Yeah, so this is where we're headed in terms of the challenges of the work that we do, which is if and when the current administration makes decisions about how they're going to allocate whatever resources are available, what's the conversation about how we continue some of the work that we know is important with a different frame? So they might support law enforcement and SROs, and we know that SROs is not a singular answer to the school safety question. How do we then work with SROs in a different way to accomplish some of the things that we know are important? So they say we're all going to have, we had this conversation a little bit last night at dinner. It's like, this is going to be but sort of a professional, moral, ethical dilemma for us. If there's money available to do X, and it's not really what we think is the right, best evidence-based, scientifically driven approach to the outcome. So I don't have a good answer other than we need to stick to here's what the evidence says and continue that conversation.